Hospitals everywhere face a shortage of radiologists, and while AI could ease the pressure, most solutions have been too fragmented to deploy at scale. CARPL is an FDA-cleared AI marketplace for radiology, helping hospitals deploy multiple AI solutions through one simple platform. Vidur, let's start with the big picture. AI has been hyped in radiology for years, but adoption still lags. What's really been holding hospitals back?
That's the reason we exist. The nuance is that while there are hundreds of AI solutions out there, hospitals find it impossible to first figure out what exists in the market, what kind of regulatory clearances they are, what use cases they have. And then secondly, they find it very, very difficult to subsequently test and validate these solutions to figure out that they actually work for their patients in their country, in their clinical setup. And lastly, let's say you can cross these two hurdles. Lastly, the deployment of these solutions into hospitals itself is extremely complicated and becomes even more complex with every additional solution. And that is why, because of this fragmented ecosystem, hospitals have really not adopted radiology AI to the extent we wanted.
Your platform connects everyone from Massachusetts General Hospital to small TB clinics in India running on laptops without internet. How do you build technology that works in both worlds?
Starts with intent, right? We wanted to build technology that can basically connect any kind of AI application to any kind of clinical scenario. So today, we have the privilege of working with more than 80 companies out there building AI applications, and then they give us their AI models in the form of what is called Docker containers. And then we take these models and deploy them anywhere from a laptop all the way to a multi-cloud hybrid kind of environment. So that's why we are able to be used by the largest and most prestigious institutions on the planet to a humble clinic somewhere in India.
Can you share one deployment that really surprised you, that changed how you think about what this technology can do?
One of our first deployments was in Brazil, in the public healthcare sector there. It's a large teleradiology group that was reading X-rays done in the emergency room. And traditionally, these scans are not reported at all. So if you're a clinician in an ER in a public hospital in Brazil, chances are that you get the X-ray scan, but you don't get a report along with it. So through this teleradiology company, we deployed our AI in these ER rooms, and that AI model creates full-fledged reports. And just seeing those clinicians get the power of that AI-generated report in a world where they had none really gave us confidence that, we're building something of consequence.
When radiologists disagree with an AI suggestion, that feedback loops back into the system. What have you learned from watching those human AI interactions play out in real hospitals?
I'd like to, clarify that uh, none of these solutions learn on the fly. So it's not like the chat GPTs of the world that we're used to now, because these are all medical devices. There's software as a medical device, regulated. What we do observe are things like how a radiologist tends to, over time, start agreeing with AI if the AI model is really good. It's a positive effect of automation bias, if I may say so.
CARPL has chosen to stay vendor neutral. You don't build your own AI models. Why is that approach better for hospitals and for innovation long term?
At the outset, from a business standpoint, we believe in not competing with our partners. So that is why we don't build any AI. Secondly, if you think of it from the hospital's perspective, our goal is to give our customers the greatest and best solution out there for them at any point in time in the future as well. The moment I start building AI, what I'm signaling is that I can build something that is better than everything else on the planet. That's why we don't build AI, because if we start building AI, it's at odds with our core value proposition.
People used to say AI will replace doctors. You're proving it's much more of a partnership. What lessons from radiology AI apply to other parts of medicine or even other industries?
Two learnings. The first is we compare a lot to the world of self-driving cars. We call our world high-implication AI, where even a single mistake, like, you could be 99.9% right, but that 1 in 1,000 mistake scaled to 1 million patients a day means 1,000 mistakes a day. So what we've learned is you have to be very cognizant, not just of the benefits that arrive when the AI is right, but of the damage that it can do when AI is wrong, again, akin to self-driving cars. The second is none of this matters if you can't demonstrate ROI. And ROI for us has three dimensions. Clinical ROI, so it has to be better for the patient from an outcomes perspective. Operational ROI, it has to make life easier for everybody there. And then lastly, and unfortunately, the most important sometimes, financial ROI has to be demonstrable for AI to be adopted.